Today we're going to talk about whether or not you have sacroiliac joint pain and what the difference is between that and low back pain. So if you've ever had low back pain or hip pain or pain anywhere in the lower quadrant and someone has suggested it might be coming from your sacroiliac joint, today we're going to go through some ways to determine and to differentiate between your low back and your sacroiliac joint. The question we're going to answer today is how to tell if your pain is coming from your sacroiliac joint. And what we're going to show you is different activities and some tests that you can do to determine, is the pain that you have in your lower quadrant from your sacroiliac joint, or is it from your low back or from your hip? They can often look the same. So we'll talk about some similarities, what the symptoms are if you have SI joint pain, and what some of the tests that you can take yourself through to get a clearer idea. And then ultimately we'll talk about ways to prevent that kind of injury and pain and how to strengthen that area, because it's a really challenging area to strengthen. Go right on to what is the sacroiliac joint? And that's kind of an important question. So the sacroiliac joint is a joint that meets your sacrum and your ilium. You can see your ilium is really is this bone here. The half the pelvis is three bones that fuse in utero. So it creates the bone that you sit on, your ischial tuberosity, and then you've got your ilium and you've got your ischium and your pubic bone. So you can see that half the pelvis, if it moves, you're going to get some movement at your pubic joint here, your pubic symphysis, and also in here. Now when we look closely at the joint and you look at the joint surfaces, you can see how bumpy it is. So this is not like a typical joint like a hip joint where there's a smooth surface on smooth surface to move. There is movement of the ilium on the sacrum or the sacrum on the ilium, but there's very little movement. Now keep in mind that when you have a joint that only has a couple degrees of movement, if you lose one of those, that's 50% of the mobility. My shoulder has about 180 degrees of movement. If I lose 90 of that, now if I lose 2 degrees of movement in my shoulder, it's not that big of a deal. So what are some of the symptoms? Low back pain, pain in your hip, pain with prolonged walking. Sometimes keep in mind that if there is a shift in the ilium, the ilium will typically shift downward, especially if you fall. When you fall, you don't land on your tailbone. You typically land on your ischial tuberosity, which will shove this one forward, and it will shift that, and it can create a lot of pain, even if it's just shifted a little bit. Childbirth can create challenges in the sacroiliac joint, particularly if you're pregnant. It's more common in women because women's joints tend to be a little bit more mobile than men. I've seen a couple men with sacroiliac joint issues. They're usually easily resolved. What are some of the other symptoms that you can get? One of the real common ways to tell the difference between a SI joint problem and other sciatica symptoms, because a sacroiliac joint can give you sciatica symptoms. And oftentimes it's from the piriformis muscle. The piriformis muscle is a really small, deep muscle that runs from the greater trochanter to the sacrum right through here, and that the sciatic nerve is made up of the joining of these nerve roots, and it will pass right underneath that piriformis muscle, which is right in the upper buttocks. And if that muscle is tight for any reason, it can facilitate that sciatic nerve and give you the same symptoms as if you had a disc problem or some other sciatica type symptoms. So it can really mimic other problems. The other thing is sometimes the low back can send signals into the hip and sacroiliac joint. So how do you differentiate those? Well, we're going to have our model Laura come in, and we're going to show you some ways to do that. Okay, so Laura, our model, I want you to relax your arms right here. I've put a piece of tape where her posterior, superior iliac spine is. So those are those two nodules right there. And then let's have you turn around. And I put a piece of tape on the ASIS, so you can see how it flares out. Now, typically, we want to see these to be level, because if you imagine this left side, if she were to have fallen and this shifts up and it's higher in the front and lower in the back, that could be a shift. Or if she has a low back problem and she comes here and the muscles are pulling her hip up, they both might be higher. So one of the things you can do is just kind of get in your underwear and look in the mirror and see if you look off, because that's an important distinction. The other thing we can do is we can have Laura have a seat right here on the end of the table. We're going to be able to see her if she does that. So if she has a disc problem and it's related to irritation of a nerve root, and it's on the left side, and I ask her to straighten her leg out here and here, and then ask her to tuck her chin down and curl forward. This is going to reproduce those sciatica symptoms. They don't necessarily reproduce the symptoms if it's coming from the sacroiliac joint. Typically, people with sacroiliac joint they're more comfortable in sitting, but when they go from sitting to standing, and they're standing for a long time and they're walking, they will get more pain in the SI joint. Another sign is difficulty sleeping. So let's have you stand up. So when we look at someone who's sleeping, if you can imagine Laura lying on her side, if she brings this right leg up and over, okay, imagine her on her left side, okay, you can relax. What that can do sometimes is open up this SI joint. So we're going to talk about, there are techniques if you want to open it that you can do that, but if it's moving too much and you don't want to open it, that can irritate your SI joint. In future videos, we're going to talk about some exercises and some techniques to really prevent irritation of the sacroiliac joint. I want to show you one more thing, and we're going to come over here to the model. So when we talk about the sacroiliac joint, it's easy to focus on the joint itself as a treatment, and there's plenty of videos on how to reset your sacroiliac joint, how to pop your sacroiliac joint. The challenge is most of the conditions that we see in our office are related to hypermobility in that joint. So sometimes we do need to reset it, but then we want to strengthen that area. The challenge is around the SI joint, there are no muscles that directly move it because it's an accessory joint and it doesn't have muscles that move it like your biceps or your shoulder. Also, keep in mind that if you imagine this as being in what's called your perineum, you have your organs. So your organs are like a big water balloon. There's fluid, and what's holding everything tight is your abdominal muscles, your oblique muscles, your low back muscles. There's a muscle called the piriformis that is in the back, but also the iliopsoas that attaches from your spine in the front of your hip. All those muscles can be involved with someone that has a sacroiliac joint. So when we show you some exercises, we're going to show you how to work with those muscles. Staying nice and stable. If you imagine if I've got the weight of, and if you look at me, I'm built in such a way that there's a pretty good amount of mass here. And if I'm not able to hold that mass up nice and tight and I allow it to kind of settle and my hips get weak, you know, I've mentioned in other videos of years back, I looked in the mirror, I'm that guy with the big belly and no buttocks, no glutes. Well, that's going to make it challenging for my sacroiliac joint because it's an accessory joint, but the muscles that support the hip and the spine, if they're weak, it's going to put more stress on the sacroiliac joint. So when we move to future videos talking about how to protect your sacroiliac joint and exercises to keep it strong and get you through an episode, keep in mind that we're going to look at kind of a global picture of how to keep the whole pelvis nice and stable. That can help prevent issues. Some women have, exertional incontinence when they laugh or run. With some men who get tight in this area, it's difficult to urinate. We have a couple old dogs and the female dog leaked and the old dog couldn't go. And that's kind of how it is with men. With men, it's more difficult to initiate often. With women, it's more difficult to control. And some of that can be decreased and improved with a good stability program for the pelvis, the hips, and the low back. So we're going to be looking at those in future videos. If this was helpful, send us in questions, subscribe. We appreciate your time.